You're watching TVC News. The Hydroelectric Power Producing Area Development Commission has flagged off a free medical intervention program across the 57 local governments under HYPODEC. The medical outreach will include screening hepatitis and treatment of surgical cases. Chineme Bamayi reports.
Poor access to special medical healthcare services remains a major problem to rural dwellers in Nigeria. Access to healthcare services include the quality of care, physical accessibility, availability of the right type of care for those in need, and financial affordability. While the government is working towards improving access to primary healthcare services, the Hydroelectric Power Producing Area Development Commission, HYPODEC, is organizing this medical outreach to bridge the gap in healthcare delivery by bringing doctors who are specialists in their field to the people who hitherto cannot access them in their locality. The medical team will diagnose and treat common cases including malaria and cases that might require surgery such as hernia, hydrocele and ganglion. Flagging off the exercise, Managing Director of HYPODEC, Abubakar disclosed that the medical outreach is scheduled to be done quarterly.
We are doing this because we realize that the people do not have access to specialist medical attention. Most of the medical facilities near them are either primary health centers or rural health centers, and they don't have the opportunity of meeting consultants and professionals in the different disease areas that may be affecting them. So that's why we decided to mobilize specialists, consultants in different fields to come here to at their doorstep.
The intervention is okay, and we are looking forward to more of these interventions for our people. So we are grateful to the HYPODEC.
Well, most of the common cases that we are attending to since we started this program are hypertensive cases. Then we will also be attending to people with low backache.
I am glad to be a beneficiary of this initiative. Whoever that hears of this outreach should come and be part of it. This outreach will be of great benefit to those who cannot afford healthcare services.
This intervention is targeting 10 to 12,000 people across 17 local government areas in Niger State and is expected to be extended to other HYPODEC states in the country. Chineme Bamayi, TVC News, Mina.
Now, are you aware that each year recyclables save more than 700 million tons in global carbon emissions? But by 2030, this figure is expected to have increased to 1 billion tons. With this in mind, environmental advocates are urging for better ways of recycling, which will save more lives and the environment. Kemi Balogun reports.
It is Global Recycling Day, a day set aside to encourage people to think again about what is thrown away. This year is shifting focus to celebrate the recycling fraternity, those who put themselves on the front line to collect waste and recycle them during the multiple lockdowns.
To support improvement,
this school in the heart of the capital city is doing its own part to ensure that waste is used for the good of the students and not left to be harmful to the environment through the construction of this toilet.
We need to keep the world clean and the environment clean so that we won't have like issues with the environment.
Encourage, and I'll also put waste bins in every corner of my house so that it can be easier if you want to recycle anything rather than throwing it on the floor, and also be hygienic.
When you get this waste and you're able to segregate them properly, you'll be able to know which one you can recycle and they will be of use. Even in the school here, that is what we do.
Global Recycling Day was created to help recognize and celebrate the importance recycling plays in preserving the primary resources of the planet. Environmental advocates like Dorothy believe that recycling is one way to save the planet and secure its future.
Most of the waste we generate in our offices, in our homes, in our schools are majorly recyclable waste. I'm talking of paper, I'm talking of plastic and metal. So what we do now, instead of evacuating this waste to the dump sites, we train cleaners for free to segregate this waste using the color-coded bin And when they segregate it, we evacuate it to a recycling company free of charge.
The day strives to urge world leaders that recycling must be a global issue and encourage people to think resourcefully and not waste. Kemi Balogun, TVC News, Abuja.
The Nigerian Medical Association (FCT) is proposing an extension period for the disengagement of the public-private partnership arrangements between the Federal Capital Territory Administration and the current management of the Garki General Hospital, Abuja. They believe this will give room for a more effective, smoother and more humane transition for both the patients and more than 900 medical personnel that could be affected. We have more in this report.
Since the 1st of March this year, reactions have continued to trail the notice served to the management of the Garki General Hospital by the Federal Capital Territory Administration to vacate and hand over the facility. An agreement signed between the duo in 2007 has now elapsed after 15 years, but the ripple effect caused by the suddenness of this disengagement order has been termed as ill-timed. Today, the Medical Association, who are at the verge of losing hundreds of jobs, are lending their voice to this issue, calling for a reconsideration to the time frame given so that no one is left behind.
If there's a debt to be paid and is a reason for the termination notice, I'm sure they can sit down and come to some form of agreement. Because if you rent somebody's house, you are supposed to pay rent. And so, but my worry now is the tenants who have been working assiduously in the last 15 years in that facility, who have been holding forth when all the public hospitals have been on strike. And we all know that when all the public hospitals are on strike in FCT, Garki Hospital still works, still functions. And all of a sudden, you're asking them to pack their bags and go home within a short period.
I don't think 1 month is reasonable notice for a facility of that nature. And that even if it is also part of the agreement, looking at the facilities, we feel that using self-help will not be advisable. Because what happens if at the end of 1 month, they are unable to evacuate?
The group also wants the federal government and the Nigerian National Petroleum Corporation to look into the present fuel crisis happening in the country in order to lessen the burden on doctors.
The situation has severely affected the practice of medicine. Health workers are now finding it increasingly difficult to get to their places of work to discharge their duties, not to mention the adverse effects on productivity.
Lawmakers on Thursday had resolved to ask the FCTA to stay action on the termination of the concession agreement, pending the intervention of the Committees on Privatization, Commercialization and Health Institutions on the matter. More than 100 doctors and thousands of patients could be affected if the FCTA goes through with the vacation order. Kemi Balogun, TVC News, Abuja.
We're talking sports now. Hosts of the University of Lagos Unilag have started laying the athletics track as the Nigeria University Games NUGA begins. Solomon Ajuziogu spoke with the track experts at the Unilag Sports Center.
The last time the University of Lagos hosted the NUGA Games was in 1998. Back then, the track was ready a whole 9 months before the Games. But the pitch was the last to be ready for the competition.
You know, at that time we didn't have a swimming pool, so as an addition we have a standard Swiss timing swimming pool. So there has been a lot of improvement from the 98 NUGA to date.
We're not always in a hurry to do things, though we would have loved to do it earlier, but you know, the way things are, we take things the way it comes.
The Unilag NUGA Games appears to have faced the challenge of funding as the largest contingent ever of student athletes converge on Lagos.
Availability of funds would be like a reference point here. The previous time there was adequate fund budgeted for the event, but in this case there's no fund for this, you know, major. I mean, this special event.
24 years after, Unilag is back hosting the games, and this time the pitch has long been ready, but the track is yet to be laid for the athletics event, even on the first day of the games. With athletes gearing up for action on day one, the athletics track experts arrive to begin work. They are sure that the quality of the track to be laid in Unilag would have a durable lifespan of up to 15 years.
If all the material is here, we should be able to lay this within 5 days. Your finished coat may not be here on time, but your subcoat, your black coat, and everything will be done within 5 days. When we get the top coat on it and the red coat on it and it marked, you should have absolutely no problem in any way within 10 to 15 years.
The more than 10,000 athletes and officials from almost 100 universities can now begin the games while they await the laying of the track. Salomon Ajizugu, TVC News, Lagos.